Okay, folks. Hi. This is Mary Sue Lanigan. I'm going to mute all of you right now because we're getting a lot of feedback. I'm with Michigan Parkinson Foundation. Meghan, you'll have to unmute yourself, okay?
Yep, I'm unmuted.
Okay. Okay, we are, I'm with Michigan Parkinson Foundation, and we are delighted that we have one of our favorite speakers tonight, Meghan Malley, who is a doctor of physical therapy at the Recovery Project. She is going to speak on the role of exercise, DualTask Training, and general wellness in Parkinson's disease. Meghan, as I mentioned, is physical therapy. She's also the program director in physical at the Recovery Project. She is so knowledgeable. She is specialized in neurological disorders. A lot of the folks in the Metro Detroit area go to the Recovery Project, and honestly, I think it's the best physical therapy practice for people with Parkinson's. Sorry, a little commercial there. I'm not getting paid to do this. This is just the truth. So on that note, I give you, Meghan, I've muted all of you. If you could hold your questions until the end. When you want to ask a question, you can unmute yourself. The mute is a little microphone. It right now probably has a line through it. So just click on that microphone and you will unmute yourself. Or if you see a chat box somewhere on your screen, you can type in a question in the chat box. Okay, Meghan, I'm going to make you spotlight.
All right.
There you go. All right, thank you.
Thank you so much for having me, Mary Sue, for your kind words. I really appreciate it. We love the Michigan Parkinson Foundation at the Recovery Project. And I have to say hi to several of my my buddies here I see on attending today, either that come to the Recovery Project for therapy or for our wellness classes. So I just want to say hello to all of you. So thank you so much for having me, like I said, and I'm going to get into our presentation here. I'm going to share my screen and go through some information on some of the latest research about why exercise is so important, especially for Parkinson's disease, and you know, how that can help with management of your symptoms. Sorry if you hear a dog barking in the background here. So let me go ahead and share my screen, which of course, Mary Sue, we tested this and now it's not showing up that I can share my, yeah, it says it's allowing me to share screen, but it's not bringing up my PowerPoint, which is.
I made you let me remove Spotlight and see if you can do it.
Okay.
Now does it allow you to do it?
Let's see. No, it just goes to the whiteboard. Oh, wait, let's see.
There you go. Wait a minute.
Whoops.
We had it. I think we had it.
So
no, you're sharing now.
Yeah, it's weird. It was letting us a minute ago before we got on here.
I didn't do anything different. Let me do Spotlight again. Your co-host. Do you want to email it to me and see if I can share it?
Let's see here. 1 second. We'll figure this out. Hold on, everybody. Well, always a technical thing. Let me see.
Oh, it happens to me every time I have to share my own screen. I have it there and then I test it. And then when I need it, we'll get it.
Yeah, let's see. Oh, here we go.
There you go.
You guys got it now?
Yeah, and then go to slideshow. Yeah, there you go. Yep.
Perfect. Okay, so thank you. Sorry for that. Okay, everybody. So like Mary Sue said, I am the program director over at the Recovery Project. I'm also a physical therapist, and although now I'm not actually treating due to my other role as program director, but I really have specialized in Parkinson's my entire career, and I'm really passionate about helping people with Parkinson's disease live their best lives. So let's get into this. So just a few objectives to let you know. I'm going to go through just a little bit of the physiology of Parkinson's. You might really already know this, but I just want to lay a little bit of that groundwork so I can explain why the types of exercises we're going to talk about and training is really important and how that really impacts the disease process at the level of the brain. We're also going to go into the role of exercise in managing some of the symptoms you may experience with Parkinson's and what a neuroprotective benefit means and how that can play a role. We're going to talk about the concept of forced intensity training and forced intensity exercise and what that is and why it's important if you're living with Parkinson's. We're going to also talk about a concept called DualTask Training and why that's beneficial if you have a diagnosis of Parkinson's disease. And then we'll get into some group classes and some different programs that are available throughout, the country and review the benefits of those and what each of those are. So just a little bit of background, as I mentioned, about the physiology of Parkinson's disease. It is a neurodegenerative disorder affecting neurons in the brain. So really, that means that many Parkinson's disease symptoms are due to the loss of dopamine producing neurons. And dopamine is a neurotransmitter that is responsible for moving electrical signals throughout the brain. So it's very important in its role of producing coordinated movements. And the dopamine is produced in the substantia nigra area of the brain, which is in the basal ganglia. So you can see on the slide there, where that's located in the brain. And the reason that's important is that the basal ganglia is responsible for carrying out both motor and non-motor functions in our body. And it really needs dopamine to function properly. So when dopamine levels decrease, that's when it causes some abnormal brain activity, leading to impaired movements and symptoms that you may experience living with Parkinson's. So as you may know, there's many symptoms of Parkinson's, whether they're motor or non-motor symptoms. And the 4 primary motor symptoms of Parkinson's disease are tremor, rigidity, which rigidity is, muscle stiffness that can happen throughout the body, especially through the spine. It can also be associated with bradykinesia or akinesia, which is another symptom I'll get into here in a minute. And rigidity can really impact a lot of your day-to-day activities and movements. It can also affect facial expression and posture, arms swing, when you're walking, things like that. Also, just, as I go through these symptoms, please know I want to add that caveat that just because I'm going through these does not mean that everyone with Parkinson's is going to experience all of these. It is not a one size fits all. And I don't want to scare anyone thinking that all these things are going to be, in your future. Everybody presents differently, and some people don't have some of these symptoms where others might. So akinesia or bradykinesia is another hallmark symptom of Parkinson's. So akinesia means absence of movement, where bradykinesia means slowness of movement. So this is a hallmark sign due to really the difficulty of the basal ganglia sending those proper signals and telling the body, how to move properly. And postural instability is another motor symptom. So this really Parkinson's affects the reflexes required to keep us upright and balanced. So you might experience postural instability when you're trying to get up from a low chair or get up from bed, with turning while walking or pivoting. And sometimes people do experience this even when they're just standing still and might feel like they're falling backwards, for example. And there are a host of non-motor symptoms as well. So there's some called autonomic non-motor symptoms, which autonomic symptoms really are regulation of our, daily bodily functions. So that could mean blood pressure regulation. If you stand up and feel lightheaded, that's called orthostatic hypotension. That can be common as a non-motor symptom. Bowel and bladder function may be affected. Heart rate response, things like that. And then there's the neuropsychiatric component that deals with executive functioning of our brain, which we'll get into a little bit later, our emotions, and cognitive dual tasking, which we'll also talk about later. There's also some sensory components, and sorry that one portion is covered there a little bit, but that says impaired smell, which may be a symptom you experience, pain. Some people have restless leg movement or visual hallucinations. And then there may be other symptoms too, such as fatigue, weight changes, dry skin, things of that nature. So, a lot of people think of Parkinson's, and they think of maybe celebrities they've seen with the disease, and they just think of tremors. But we really know that many symptoms of the body are affected by a PD diagnosis. So with all that said, let's talk about force use intensity and what that is and really why that's important. So, as a precursor, I would be remiss if I didn't talk about just the positive benefits of exercise, which, many of us are obviously very familiar with, but it's so important to go over because one of the reasons I'm so passionate about working with people with Parkinson's is that it's one of the neurological disorders where we really see such a huge benefit of exercise. It is, I would argue just as beneficial as medication for Parkinson's disease, where we don't always see that with other neurological conditions. And the benefits of exercise can really be profound, and more research is coming out really speaking to that. So some of the positive benefits of exercise that really translate well to somebody with Parkinson's are that it improves balance and walking, which we know is affected in PD. It can help decrease rigidity and improve joint mobility, which then can also have a positive impact on pain. It improves bone health, which is important because, if you are aging, you're already at risk of decreased bone density. And then if you compound that with a condition that causes mobility issues and maybe you're not moving around as much, you're at a higher risk of osteoporosis. And if you had a fall, you would be at a higher risk of a fracture. And so improving bone health is important. Exercise also can improve cognitive function, which we know that there can be an increased percentage of some cognitive changes if you have a Parkinson diagnosis. So exercise helps with that as well. Increasing cardiovascular health. So we know that everybody needs to, be mindful of their cardiovascular health. But again, especially if you have Parkinson's, more and more research is showing that increasing your heart rate and really working at a higher intensity and improving that blood flow to the brain, and not only helps with, lung and heart function, but the impact on the brain is really important. Exercise can decrease depression, and we know that there's a higher rate of depression with Parkinson's disease, as well as any, chronic illness. Exercise can help combat fatigue, which we know fatigue is prevalent in PD. It can help decrease tremors and can assist with other non-motor symptoms such as digestion and decreasing constipation, which is often a problem for many people living with PD. So I obviously am passionate about that and could go on and on about the positive benefits, but those are some primary ones. So what is forced intensity exercise? And what this is it means intensity that is not self-selected. It is selected by outside forces, which means it could be something like the speed of a treadmill. So forced use would be if I put you on a treadmill and you didn't just get to select the pace, I increased the speed, obviously safely where you can complete the activity, but that would be one example of a forced intensity exercise. Another one could be maintaining a certain amount of RPMs on a tandem cycle. So somebody riding on the bike with another individual, and they say someone with Parkinson's is kind of forced by someone without Parkinson's on the tandem cycle to try to maintain a certain level of RPMs. And so that is another example of forced intensity. And then a third example is trying to reach a target heart rate. So this is something we talk about a lot with talking about the terms high intensity or moderate intensity. And that's usually based on a percentage of your maximum heart rate that's appropriate for your age. And if you're trying to reach to exercise at a certain heart rate, that is a way to help force your intensity to achieve that number. That might be a little bit out of your comfort zone of your self-selected intensity. So all of those allow for more high intensity workouts. And the reason that's so important if you have Parkinson's is because more research is coming out all the time that shows that higher intensity exercise really has a neuroprotective benefit on the brain, which what that means is that it can potentially help slow the death of those neurons, the loss of those neurons, and, thereby really helping slow the progression of the disease. So that is just crucial. And if we know that potential is there, then, why not participate in this type of exercise program? So one thing you might think, well, is that safe? I don't, feel my best. Sometimes I lose my balance. I feel rigid. I feel like maybe I've lost some strength. Is it safe to exercise at that intensity? Maybe you feel like, am I reaching an age where that might not be appropriate? And there's actually been a lot of studies looking at that very fact. And one of these was a treadmill training study a couple of years back in 2018, and it included 128 people with Parkinson's. And they worked on treadmill training for 30 to 40 minutes, 5 days a week. So that's pretty good. And what the high intensity group was defined as working at that heart rate range of 75 to 85% of their age predicted max heart rate. So just to give you an idea how you figure that out is you take 220 minus your age, and that is your age predicted maximum heart rate that's safe for you, the max. So high intensity training is for this study was looking at people working at 75 to 85% of that maximum age predicted heart rate. And what they found when they worked that group at that level of intensity for that duration, 5 days a week, 30 to 40 minutes, they found 6 months later, they had no decline in their Parkinson's symptoms and in their function, where they had a moderate intensity group and a non-exercise group, a control group. And those groups both declined after 6 months in some of the testing that they did. And even the moderate intensity group, who was exercising at 60 to 75% of their maximum heart rate range. So that study showed in their results that not only was it an effective program, but there were no adverse reactions. So nobody, had any negative consequences for exercising at that type of intensity, and it was indeed beneficial. Let's see, another study looked at high intensity cycling, so with a stationary bike, and this was one that looked at that tandem cycle study. And so this used a group that had cycled at a voluntary rate, what was comfortable for them, RPM wise, and then a forced intensity group. And the forced intensity group cycled at that 60 to 80% of their maximum heart rate. And what was great was that significant improvements in motor function and even hand dexterity were seen in that forced intensity group, and only in that group, which was interesting about the hand dexterity, where they didn't even really work on hand function, but just they were working on holding that, the handles of the bike. And they pedaled with a trainer at a rate 30% greater than their preferred voluntary rate. So that trainer on the bike with them really helped push them beyond what they thought that they could do just comfortably. And if you're familiar with the UPDRS, that's the Unified Parkinson Disease Rating Scale, and it's a tool used to measure the severity and progression of Parkinson's disease. And the UPDRS motor score increased 35% in the high intensity group, where there was no change in the group that just cycled at their own comfortable pace. So again, it showed no adverse reactions. So it was not only safe, but actually effective in really helping improve motor function. So, is it safe overall? These studies and many others have shown that it is. And in fact, just last month, the American Physical Therapy Association came out with what they had been working on for several years called clinical practice guidelines for physical therapists across the country. And they evaluated, dozens and dozens of studies. And what their recommendation was they give recommendations in a variety of categories. And when it came to high intensity training and cardiovascular training, their recommendation was physical therapists really should be implementing moderate to high intensity aerobic exercise with their clients to improve oxygen consumption, reduce motor disease severity, and improve function in people with Parkinson's disease. They really showed the evidence was very high and gave a strong recommendation that this should be part of a treatment plan, whether you're in therapy or you're, exercising on your own or in a group class. So overall, it really shows exercise is medicine if you have PD, and high intensity, in a safe setting and, with the approval of your physician is really best. All right, so on to dual task training and what that is, and, are two tasks better than one? So just to give a little background before we dive in, I mentioned executive functioning earlier, and this chart on the right shows a lot of different components of executive functioning. But a couple I want to touch on are working memory, which means holding on to a relevant task information while performing a task. And then another one is attention, where attention is part of executive functioning. And there's either sustained attention, where you're kind of maintaining like a single focus, or divided attention. And that is where we talk about dual task focus and being able to divide your attention among more than one thing. So that's where we talk about dual task training with Parkinson's. And really what this is putting that executive functioning into action. And, we talk about this in a variety of ways, and it's really about an activity in which an individual needs to manage two separate tasks simultaneously. So that could include two cognitive tasks, like say, for example, I'm trying to talk to somebody at the same time that I'm trying to think of something. Those are two cognitive tasks. Or it could be two motor tasks. So the individual in this picture, he's weaving in and out of cones, but he's also bouncing a basketball. That is two motor tasks. Or it could be a cognitive and a motor task together. So for example, I'm in the grocery store and I'm working on walking and pushing a cart, which is, a motor task, but cognitively, I'm also trying to think about my list and scan the aisle and, pick out my groceries. So there's many ways dual task training presents in life. And that's why it's so important, because we have to do this throughout our daily life. It's almost rare, especially in this day and age, where we can really focus on one thing without distractions or even as simple as walking and talking. That is something we often take for granted, but we can see, especially in a few tests that we do with our clients with Parkinson's, how adding just talking while doing a motor task can really slow that down and impact function. And so we know with Parkinson's, there is research that shows there's a decreased ability to dual task for many people. And one of the hard parts is that we also know that for many people with Parkinson's, they can have a lot of gait or walking impairments. So when you add those and compound those together, and you add the exacerbation of gait impairments, and you put that under dual task conditions like walking and talking, that really compounds the problem, and you can be at an increased fall risk. You can see more shuffling or festination of steps. That makes walking really difficult. Reduce postural awareness of not even knowing you might be starting to sway or lose your balance. And overall, a decrease in safety awareness and overall safety. So the good news is that this can be improved with the right training, and motor and cognitive dual task training can be improved with very specific task training. And studies have shown that it can improve a variety of things, but some of the most notable ones are your walking speed, which is really a predictor of overall health and quality of life. It's sometimes referred to as the sixth vital sign because it's very closely linked to life expectancy, mortality rates, things like that, as far as how fast you can walk. It's also been shown to improve stride length, so how long your steps are, which is important because we know sometimes with Parkinson's, you can get short, shuffling steps. DualTask training can improve balance and also improve cognition. And the other great thing is that it can also improve what we call automaticity, which means your ability to respond more automatically to cognitive tasks while you're walking. And so, that might be, say you're walking and someone cuts right in front of you in a store and it allows you to respond quicker, which overall improves your safety, your independence, and your quality of life. So, dual task training has become something that we really are trying to incorporate, whether it's in a wellness class or in therapy, or just trying to educate people at home how you could maybe incorporate that in day-to-day life. So that could be, in ways that might seem kind of silly, but really can help. So, it might be something where, like say, for example, in some of our wellness classes, when we're doing repetitions of exercises, we will count backwards from 10 to add a cognitive task at the same time as doing a motor task. All right, which leads into me bringing up Parkinson's disease specific group exercise classes. So, you may be familiar with the benefits of one-on-one therapy, whether it's PT or OT or speech therapy for voice or swallowing or cognition. But there's also a lot of great group exercise programs available for Parkinson's. And there are so many. I'm just going to touch on a few of the most common ones and ones that I really believe in strongly here. So the first being one called POWER, and POWER stands for Parkinson Wellness Recovery. And you may have heard of LSVT Big, and this POWER program kind of stemmed off from that. So Becky Farley is a physical therapist who was the one who created LSVT Big. And in 2010, she branched off and started Parkinson Wellness Recovery, known as POWER. And really, this is a very comprehensive program based on principles of neuroplasticity, meaning trying to really improve the function of the brain. And it integrates the latest research on Parkinson's disease and rehab, exercise, and wellness. So it's not always just the same repetition of exercises. It's really adaptable and modifiable and evolves with the more that we learn about Parkinson's. And POWER's mission is to really develop and implement worldwide access to cutting edge Parkinson's disease specific neuroplasticity principled exercise programs that hold promise to slow disease progression, improve symptoms, restore function, and increase longevity and quality of life. So this is an excellent program that has therapists and trainers and exercise professionals certified throughout the country. And really there are a lot of great benefits and focuses of POWER, but a lot of it is based on PD specific skill training to help maintain or restore skills that often deteriorate if you have PD and really can interfere with your everyday activities. It improves neural connections and circuitry in the brain. And it really is focused on, like we talked about, high and forced intensity. This is similar in the sense that it really focuses on high intensity, high amplitude movements, meaning really large, big movements, because you have to try to move twice as big and speak twice as loud when you have PD to really have that output be maybe what it is for somebody who doesn't have Parkinson's. So it's a really program that is often incorporated into therapy or as a group wellness class. As I said, it's really involving large amplitude, high effort movements. And it really also has a great benefit of working on moving in different positions and postures, which is really important. It's not all just in a chair or not all seated. It's of course modifiable if you say you just had your knee replaced and you can't get down on the floor. But there's such benefit in working on being able to transition into different positions, to be able to get up and down from the floor, to be able to roll so that you can continue to roll easily in bed, for example. It specifically targets skills shown by research that interfere with mobility in people with Parkinson's disease. So anti-gravity extension means the postural muscles on our back. So we know that those posterior chain muscles really can get lengthened and weakened as we start to lose our posture and flex forward. And so working on those muscles and helping maintain our posture really is important. It works on weight shifting, which is a lot of a difficulty with PD oftentimes, is just initiating movement and shifting weight. Axial mobility, as I mentioned, rigidity is often very common in the trunk and axial muscles. And so it works on a lot of rotational tasks and things to break up that rigidity so you can move easier, freer, more fluid with less discomfort. And translation of movement. So being able to initiate changes of position, things of that nature. So what's great is, again, it's really adaptable, and if it's a group class, it can be up to the creativity of the instructor and how they incorporate the principles of the POWER program. And it can be really translated into any activity, any exercise program, or any setting. So highly beneficial and a lot of fun, and not always the same exercises day in and day out. Another really wonderful program is Rock Steady Boxing. And this is a nonprofit that was founded back in 2006. And it was founded by, the backstory is there was a young individual. He was diagnosed with early onset Parkinson's. And he was, I can't remember if he was in his 40s or just early 50s, but he fell, into a depression thinking, gosh, this is as good as I'm going to feel. And every day moving forward, I'm going to potentially feel worse. What is my life going to look like? And his out of his funk a little bit, if you will, asked him to just come exercise with him and come to his boxing gym. And so he started boxing with his buddy. And all of a sudden he started noticing that it was really improving his symptoms of Parkinson's. And so he enlisted a world champion boxer, and together the two of them opened up Rock Steady Boxing in Indianapolis in 2006. And now they have affiliates all over the world. And so this is a great program that really provides hope to people living with PD to improve their quality of life through a non-contact boxing-based fitness curriculum. I always like to stress that because some people envision we have like a boxing ring and two people with Parkinson's are gonna, go in the ring together, but that's not what this is. And their mission is to really empower people with Parkinson's to fight back and to feel like you have some control in your health and in your wellness, and that you can really work at improving this. So it's not just boxing drills. The class is really made up of a great variety of activities. And again, it's using those principles of high effort and high intensity. We also work on dual physical and cognitive tasks. And what is really cool, and what researchers now started to show that they've been researching this program about, why is this working so well for people? What is it about boxing with Parkinson's? And really what a study by ESPN was done years ago that looked at every different sport. And they found that boxing was the most challenging in the sense of all the different aspects of fitness that it, deals with and that it requires. And many of those translate really well to the issues that people with Parkinson's face. So a boxing-based curriculum works on agility, which we know is an issue with Parkinson's, strength, speed, endurance, hand-eye coordination, footwork, cardiovascular conditioning, coordination. I mean, I could go on and on. And so that's why boxing is such a great tool to use to help manage your Parkinson's disease. And not only that, but it's a lot of fun, and people love it and feel really strong and empowered. And it's a great program. So, those are just a couple, but there are really so many, and all exercise is good. But what we really know is that PD specific exercise, such as power or rock steady boxing, is better. And it's really designed to target symptoms of PD. So it's not that, going on a walk is bad, or swimming, or doing yoga or Tai Chi. All of that is so great. And there's benefits to all of that. But we know that these programs are specifically designed to help target the symptoms of Parkinson's, whether that's rigidity, fascination, that bradykinesia, slowness of movement I mentioned, microphonia, which is a low volume of voice, which is common, or micrographia, which is small handwriting. And the people who teach these classes have really gone through training and instruction and education to better serve the population of individuals living with Parkinson's. So not every trainer at your local gym really understands the complexities of the disease. And so that's why these types of classes are so beneficial. And, you hear me mention the word research a lot, because I'm all about really what the research says. And again, in that clinical practice guideline that just came out for all physical therapists, they really looked at all the studies over the years that have looked at community-based exercise programs for Parkinson's. And really what they found was that there was extremely strong evidence supporting the benefits, and that physical therapists should recommend community-based exercise programs to reduce motor disease severity. So they found they reduce the motor severity, and improve non-motor symptoms, which is a great benefit that we're finding, that this can even improve those non-motor symptoms you might deal with, improve function and quality of life in people with Parkinson's disease. So that is huge, that looking at all the research studies, that was their summary recommendation. And, especially the part about non-motor symptoms, because that can often be frustrating and feeling like, does exercise really help with that? And it really can, especially with things like depression, anxiety, sleep, digestion, just to name a few. And another huge benefit that, I have to add is that really group exercises are so impactful, because not only can they be considered a form of forced intense exercise, because we tend to work a little harder when we have other people, around and working out next to us, but the supportive atmosphere has really positive implications for both mental and physical health. And whether that's in person or virtual, even in a virtual format, just showing up and knowing that other people are expecting to kind of see you there on screen, it's really that socialization helps with motivation. There's some camaraderie and accountability. And especially over the last couple of years, we know that we need that connection. And without it, we might suffer some consequences to, our mental health and overall well-being. So that was a lot, but that's all the information I have for you. So this is just a quick little slide showing our 3 locations in Livonia, Clinton Township, and Lansing. And we really do specialize in Parkinson's, and not only having therapy, PT and OT and speech, but also we have a big group wellness program, just like Michigan Parkinson Foundation does in their programming as well. So I know there was a lot of info. Does anybody have any questions?